So listen to what Bryce said, and then we'll get the doc's sense of it. Here's what Bryce said a few days ago.
I didn't think I was going to take any other steps forward of feeling better or anything like that. I thought we were kind of at a standstill of it feeling the same the last couple of days, and from BP to live and things like that kind of gave us the same result each day. So I thought today was a good one.
So when we heard standstill, that kind of gave us a shudder. Like, all right, he's improved, but he's not nearly where he wants to be. And so what does that mean? Well, that means we turn to the NovaCare Rehabilitation Injury Report. Dr. Michael Pensak is an orthopedic surgeon specializing in hand, wrist, and upper extremity care. He holds a subspecialty certificate in orthopedic surgery of the hand, which is a designation granted to board-certified surgeons in hand surgery beyond those of other orthopedic surgeons. He's a real expert in this area, right there where the wrist is. Dr. Pensak joins us. Dr. Pensak, good morning, sir.
Good morning.
So we're really fascinated to get your perspective. For everyone listening, full disclosure, Dr. Pensak has not, treated Bryce and obviously is able to comment in a generic sense because he's just talking as a doc what it could be. So, Doc, let's get to it. Based on the fact that it impacted Bryce last year, he rested it. There was no surgery. It improved. He started playing this year. It set back in a more extensive way. He sat out. It improved, but it was a plateau. What would be your guess of what the issue is? What range of possibilities could it be?
All right, so my take on this is most likely a soft tissue problem. If you focus on the MRI that was just performed and is out there suggesting inflammation in the wrist, you're really talking about 5 or 6 structures at play. You've got bones, you've got nerves, you've got tendons, muscles, ligaments, joint capsules. It's probably not a bone bruise. You typically wouldn't refer to a bone bruise as an inflammatory condition. You're talking about an occult fracture you only see on MRI or swelling in the bone. So I don't think it's a bony issue. That would most likely slowly resolve over time. Typically, if there was a nerve problem, you'd be referring to that as more of a neuritis. So it can be inflamed, but there's more descriptive language you would use to describe a nerve problem. So I'm focusing more on tendons, muscles, joint capsules, and the associated ligaments. This, to me, sounds like an acute on chronic situation where there's been damage to soft tissue that has given time to heal, and then it gets re-injured, re-exacerbated from whatever forces the athlete is putting his body or that region of the hand and wrist through. So a couple of things that I think about that I see commonly in my practice are ulnar-sided wrist pain. That's pain on the pinky side of your wrist. So there's a soft tissue disc there, very similar to the meniscus you have inside your knee, known as the TFCC, triangular fibrocartilaginous complex. That's prone to tearing. That can be a very nagging source of ulnar-sided wrist pain. It can wax and wane. So that's one thing that stands out to me. That disc has a poor vascular supply in the central third of it. The outer rim of it has good healing responses. There's a rich blood supply there, but that can tear. And depending on how much rest, it can calm down and then flare back up again.
And you're saying the poor vascular supply, Doc, that means essentially it takes longer to heal. There's not as much blood there, so it's just you got to be more patient with that, coming back from that sort of thing.
Parts of those discs don't heal, and if they ever progress to surgery, sometimes we just have to go in and debride or shave down the tissue that is unable to mount a healing response.
Oh, jeez.
Would you feel that would an off-season surgery, in your opinion, fix it if the situation calls for it?
It certainly could, but there's still a host of other pathology at play that may not even require a surgery. There could be a very bad tendinopathy. You could have an ECU subsheath injury. You can have a bad case of de Quervain's tendonitis, which is on the thumb side of your wrist. Man. These are extraordinarily painful conditions, and it depends what sort of conservative care the athlete or patient wants to employ. This could simply respond to immobilization, anti-inflammatories, corticosteroid shots, but there are many athletes who don't want to put some of that stuff in their body, and that could prolong the healing response. I could tell you, if you were like a weekend warrior in my office, you'd most likely be getting a cortisone shot for any of the pathology around the wrist, if it's a tendon or TFCC type of injury. But an athlete may want to, professional athlete at that level may want to hold off.
But but that is, like you said, that is an option that could make it feel better, that could reduce the inflammation. When you say it could respond to immobilization, that's the way that we dealt with everything. Like in football,
Sure.
in my sport, when it was wrist, you just tape it. Like that's. But I know that in baseball, why is it so difficult to just tape it?
Well, hold it. Well, let me just say this.
Baseball,
think about a bat. Think about swinging a bat. Like it is so
It's all on your wrist, yeah.
It is right there.
Why is it so difficult to just tape it?
It's very hard. The wrist has very complex kinematics. You're talking about 3D motions that you have eight wrist bones. There's 2 rows of wrist bones that articulate with either the hand and or the forearm. In order to get the proper kinematics to swing a bat at their level, to catch balls and throw balls, you just can't shut the wrist down without affecting their performance and motion. So some types of bad wrist pathology, they require, 6 weeks of immobilization and something called a Munster splint to shut down all their pronation and supination. That's the rotational motion about the long arm, about the long axis of the forearm.
Wow.
And that may not be feasible in season.
Wow.
And that's why I think this is, definitely a soft tissue, very close to being a soft tissue thing definitively because of the acute on chronic nature of this. It's
Wow.
like it responds to rest and then flares up with activity.
So, Doc, final question here. I'm going to combine short-term and long-term. Short-term is this year, of which there's 4 months if they go all the way through the World Series. Long-term, there's 6 years after that. Short-term, how much of a problem to play with and through? Long-term, how much of a problem as you perceive it?
Again, it all depends on the detailed findings of that MRI, which I'm not privy to, as he's not my private patient. But this could be solved in potentially 2 to 6 weeks if it's something that would respond well to a corticosteroid shot. If it requires surgery down the line, it's possible he could be temporized through the season and then something in the off season, and that could solve it for the rest of his career. I mean, there are plenty of people who do respond well to a wrist scope and a debridement or repair of their TFCC, and that's the end of it. But there's not enough information out there to opine further on that, and I don't want to circumspect beyond that because there's a lot more detail that goes into that kind of.
But it seems like he wasn't. It seems like that wasn't part of the plan for the last few years, the debridement in the offseason.
Yeah, a little concerning that it wasn't taken care of last year into this year.
Yeah, why would that be the case, Doc?
That could be player preference. Again, without looking at the images and seeing what is actually damaged, it's hard to further opine on that.
Yeah.
Got it.
Well, Doc, I appreciate your time. I'll tell you what, if I have one of these issues in the hand and wrist region, I'm coming to you. Dr. Michael Pensak, an orthopedic surgeon specializing in hand, wrist, and upper extremity care. He sees patients at Ocean Orthopedic Associates in Toms River and Old Bridge, New Jersey. For more information, go to michaelpensackmd.com, all part of the NovaCare Rehabilitation Injury Report. Doc, thank you, sir. Much appreciated.
Thank you, guys. Have a good one.
You got it. Very interesting. Well, kind of like I expected. Could be fixed or maybe not.